How do you get a diagnosis for endometriosis? Well, the thing is that's very tricky. It can take between 7 to 10 years to be diagnosed with endometriosis. And the reason being is because we have no definitive test. There's not a blood test at the moment, although some are in development. There's no hair sample that we can take, a urine sample. Even scans, such as an ultrasound scan or an MRI, can miss it. And the gold standard test, which is a diagnostic laparoscopy, even that can sometimes miss it, but that is currently the way that we are diagnosing women and girls with endometriosis, where a small biopsy is taken. Let me just explain a little bit why it's difficult to diagnose endometriosis. One is because the symptoms don't all come together. They come in different stages at different times of our life, and therefore we have to believe women and girls when they come in explaining that their periods are painful and heavy. Unfortunately, we don't also talk with our family members about periods because they're so taboo and stigmatized, and therefore women and girls think that that's normal to experience that much pain, that you're missing school, work, or even activities. Finally, the other reason is because endometriosis appears in different colors. Yep, it is not just one uniform color. Endometriosis can appear as yellow, and that can grow in your pelvis. Endometriosis can grow as blue, and that can cause adhesions. Pink as well. It can grow as orange, black, and red. As well as, get this, endometriosis lesions can grow as brown, tan, and clear. Now, if it's tan or clear, you're clearly not going to see the adhesions in the abdomen and the pelvis. So therefore, women might be told you don't have endometriosis, and therefore be told that it might be in their head, when that is not true. We need to get better definitive tests to make sure that we diagnose endometriosis early. Endometriosis is a progressive condition, goes from stage 1 to stage 4, impacting fertility and quality of life, as well as a whole body condition, which we now understand can also be linked with some autoimmune conditions, such as rheumatoid arthritis, fibromyalgia, and celiac as well. So the diagnosis is so important. The current NICE guidelines, which were updated in November 2024, please do check them out, show that actually the diagnosis of adolescents and young girls can be made through an MRI, which is available here at Welbeck, as well as making sure that we diagnose on symptoms alone. So somebody like me who does women's health and looks after endometriosis, I will be following and tracking your symptoms, and sometimes tests aren't necessary. I believe you, my patient.